During Senate estimates, it was revealed less than 10% of the aged care workforce have been vaccinated against COVID-19. Let's bring in Dr. Sarah Russell, aged care public health researcher and co-founder of lobby group Aged Care Reform Now. Thanks for your time.
Thank you.
How much of a worry is it, the fact that less than 10% of the workforce has had the COVID jab?
Extremely concerning. I mean, the way to keep residents in aged care homes safe is for them to be vaccinated and for the people who care for them to be vaccinated. That's the only way we can guarantee their safety from this terrible virus.
Are you surprised also that that guideline that saw single site payments to workers to prevent them, obviously it's not well paid, many of them need to work elsewhere, but to prevent them moving to other sites, they received a single site payment from the federal government. That ended late last year.
That's correct.
Had you heard that that was the case?
Oh, yes. I heard as early as late November, many aged care workers were again working across multiple sites. As you said, yes, these are lowly paid workers, and many of the providers in these private facilities give them, short shifts, maybe 5 hours during their peak times. And so they to make ends meet, they need to work in several aged care homes. So it's not the staff's fault that this has happened. This is a system failure. The government has known about this for a long time, and these guidelines, they keep producing guidelines for the private sector, and these guidelines are actually not worth the paper they're written on, because a provider can decide whether or not to ignore them. And in many cases, the providers have ignored the guidelines.
And just finally, the lockdown also so difficult for centres to manage because family members are often care providers themselves during visits, aren't they?
It's a terribly important point. When families go into an aged care home, they do a lot of the work. They help with meals, they help with exercise and physical activity, they provide social support. They do an awful lot of work. And many of the families during Victoria's last lockdown, they were telling me that they weren't worried their family member was going to die of COVID. They were worried their loved one was going to die of neglect, because they knew, and we all know this, having just had the Royal Commission, we know that many of these aged care homes are understaffed, chronically understaffed, and there's a lot of concern. We have to also remember right now, because staff aren't vaccinated and because residents aren't all vaccinated, many of these homes that are now at risk, the 5 homes, the residents are now locked in their rooms. And that's a devastating thing for a resident, to be locked in their room.
Yeah.